Fetal week 14. By the time you're 14 weeks pregnant, you've probably had several antenatal appointments. An indispensable part of the regulation of antenatal care in the early stages is a blood test. If you haven't had these tests or are for some reason missed, talk and check with your doctor. It's important that you get tested, have your blood type, complete blood count, and immunity to certain diseases, as well as check the health of your unborn baby. If you are at risk for a chromosomal problem, you may be offered a CVS chorionic villus sampling or an amniocentesis. Usually CVS can be done before 12 weeks, or it can be a little later. Amniocentesis is usually around 14 to 16 weeks, or a little later. Both of these testing modalities require an in situ ultrasound to determine the specific location of the placenta and the baby in the uterus. 14 weeks pregnant is the period when you start to feel reality more clearly. You have regained your energy and can focus on what is needed rather than just being tired like in the beginning. You should now start learning about your maternity leave and plan how to manage your expenses if your paycheck is cut. The 14th week of pregnancy is also the time for you to learn about child care services if you will need it. You can also start thinking about reorganizing the room in your home. Where will be the baby room? Does the baby have to share a room with siblings? All of these things take time to discuss and arrange. Physical changes during the 14th week of pregnancy. At 14 weeks pregnant, the top of your uterus will be about 16 centimeters higher than your pelvis. This means that your belly will start to protrude, and it will be easy to see that you are pregnant. You may find that your gums are more sensitive and bleed easily when you brush your teeth at 14 weeks of pregnancy. Change your toothbrush more often and only use soft ones. Brush your teeth twice a day, floss every day, and don't forget to clean the surface of the tongue because that's where bacteria are easy to breed. Oral hygiene is extremely important, and you need to have a dental checkup at least once during pregnancy, as gingivitis is one of the risk factors for preterm birth. You are still prone to constipation at 14 weeks of pregnancy or difficulty having a bowel movement. Water, fiber, fruits, vegetables, whole grains, and exercise are all effective natural remedies to keep the bowels working properly. Vaginal discharge may be more, causing discomfort but not necessarily a sign of infection. When you're pregnant, this discharge is usually milky or clear, nothing to worry about unless it's itchy or has an odor. The mucus-producing cells in your vagina play a protective role against inflammation. At this point, you may feel a sharp stabbing pain on both sides of your abdomen. That's because the ligaments and muscles that support your growing uterus are working hard, and sometimes they show signs of resistance. Try to avoid sudden movements, try to sit when possible, and avoid standing for too long. If this affects your work, talk to your boss about a change that's more appropriate for you to be a little more comfortable. Emotional changes. You feel as if your baby is taking over your body at 14 weeks, not to mention your mind. You find it difficult to focus on work at work as well as at home, because all your attention is on the baby in your belly. Don't worry that you're the only one, it's actually a common condition among pregnant women. If your pregnancy was unplanned, you should be able to start to feel less stressed by now. Many pregnant women believe that by the time they feel the baby's movement in the womb, which is around 17 to 18 weeks, they have begun to accept the reality of the baby. Don't worry too much if you're not overwhelmed with the emotions of motherhood. It's important at this stage that you know how to take good care of yourself and not take unnecessary risks to endanger you or your unborn baby. Having children can also bring about changes in your relationship with your own parents. You can relive your childhood, recall every memory, every feeling that has had a profound effect on you. All of this is completely normal. It reflects an important milestone in a woman's life, becoming a mother. How does a 14-week-old fetus develop? Your 14-week fetus is starting to be able to make side-eye movements. The eyelids are still closed to protect the eyes, but the muscles that control the eyes are already starting to work. They affect the eyes every time when strong light shines through your abdominal wall and becomes a flushed glow. There may be a lot of movements this week at 14 weeks, however, you may not feel them unless you've been pregnant before. The fetus is able to open its mouth and move its tiny lips. Breathing and swallowing movements continue to be practiced to ensure that amniotic fluid is continuously being processed in and out. Although only the equivalent of about a cup of amniotic fluid surrounds it at this point, that's enough to protect and support the baby. This week, your baby can also discover his umbilical cord and grasp it. Don't worry that holding the umbilical cord too tightly will restrict blood flow. Your baby will let go before that happens. What should mothers do in the 14th week of pregnancy? If you're pregnant during the months when flu is common, think about getting vaccinated. The vaccine will not harm an unborn baby and will protect pregnant women. You may want to take a series of pictures of your pregnancy to see how your belly will grow over the next few months. This will definitely be a good memory. And don't forget to take a picture with your husband, he is part of this mission. Filming is also a cute way to keep a pregnancy diary. It will give the most vivid images of the development of the pregnant belly. If you already have older children, now is the time to talk to them about the upcoming baby. Soon you will be able to recognize the baby kicking or moving in the womb. The risk of miscarriage is also much lower at this stage, and it's important that your baby's siblings have the opportunity to build a bond with the new baby. Don't forget to use sunscreen. You will see the pigment melanin on your skin making freckles and moles darker. Most sunscreens are safe to use during pregnancy and will not harm you or your unborn baby. Look for one that has ingredients that protect against both UV aging rays and UVB heating rays, and use according to the instructions that come with it. Tips for pregnant women at 14 weeks pregnant. When the fetus is 14 weeks old, the mother is prone to having trouble sleeping. This, on the one hand, helps the mother get used to the sleepless nights to take care of the baby when the baby is born. But at this time, the mother still needs a good night's sleep for a healthy pregnancy. Do not arbitrarily buy sleeping pills, but need to consult a doctor because there will be many ways to help you sleep well without using drugs. Some necessary tests when the fetus is 14 weeks old. Depending on the specific condition of each mother, the doctor may recommend the mother to do the following tests: checking for sugar and protein in the urine, measure weight and blood pressure, check fetal heart rate, measure the height from the base of the uterus, check the size of the uterus by external palpation, check your hands and feet for swelling or varicose veins. Like, share and subscribe to update baby care experience. Baby and I, the journey of being mommy.